Taking care of your child's teeth is the secret to a healthy smile. And it's our job to ensure that we teach our children how to brush and floss their teeth properly. According to the American Dental Association, in the U.S., oral disease causes children to miss 51 school hours annually each year, and for adults and parents to lose 25 million work hours each year, which is all preventable if we learn to teach our kids to brush and floss properly. Poor dental habits can lead to cavities, and these start on the baby teeth. So it's essential when your children first get their first tooth to start brushing that tooth. It's also different toothbrushes for different kids. We have ages 2, 0 to 2, 5+, and then adults. You don't want to use an adult toothbrush in a little kid's mouth, and vice versa. And cavities are holes in your teeth caused by bacteria or plaque. The bacteria feed on the food and drinks that you eat. So if you're drinking soda and different snacks, so much sugar that's on your teeth, the bacteria eats away at your teeth. And when the bacteria is eating at your teeth, when it causes the cavities, within 5 minutes, this attacks the enamel of your teeth and sits there and can reattack for up to 20 minutes later. So if you do give your kid a sugar drink or juice, have them rinse down with some water to kind of rinse off the sugar off their teeth. And the good news is that cavities can be prevented by a few simple steps. American Academy of Pediatrics encourages parents to see a dentist by their first birthday. And you also want to come twice a year to the dentist. That would be once every 6 months. And you can also be coming more often if they wanted to put fluoride on their teeth, or if there's any problems, they might want to see you more often than just twice a year. You want to be brushing your kids' teeth twice a day, once in the morning after they eat breakfast, and once at night right before they go to bed after they eat dinner. Once they brush their teeth, you don't want them to eat or drink anything afterwards, and have them go right on to bed. They can have a little bit of water, but try not to let them eat any food or drink afterwards. You also want to be flossing once a day. I suggest floss at nighttime before you brush and after you have already eaten dinner. And with children under 2, you want to use a fluoride toothpaste and just a little teeny smear of toothpaste. Children over 2 years old, you want about a pea-size amount on the toothbrush to brush their teeth with. You also want to use a soft bristle for the toothbrush, nothing too hard or abrasive for the kids' teeth. And you also want to replace your toothbrush every 3 months. Even though you're only coming to see us every 6 months, go to the dollar store even and buy one in between. So you want to replace it every 3 months. When your kids' teeth start to touch in the back, is when you want to start flossing. And there's a few different ways. You can floss with a string, or what I prefer for my daughter is a little stick. And as long as they're touching, you want to get back there at nighttime and floss for them. So you should be flossing once a day for them and brushing once a day for them. And you can let them brush once a day to make them feel a little independent, but afterwards brush their teeth for them and check over them. And when you are brushing, there's 5 different surfaces of the tooth. You have the top part, which is the biting, the front, the back, which would be you have the cheek and the tongue side, and then you also have where you need to floss. A toothbrush isn't going to reach in between the teeth, and that would be the front and the back of the teeth. You also want to make sure you're brushing your tongue as well. So if you ever eat a popsicle, a purple popsicle, and when you're talking you still have purple on your tongue, I can get this out. There we go. So you want to make sure you're also brushing your tongue as well as your cheeks. So that's just to show that how much food you have on your tongue, because it's changed colors with that popsicle. Taking care of your child's teeth is the secret to a healthy smile. And there's healthy choices you can do. You want to limit snacks to 2 a day in between meals. Try to make them as healthy as you can. If you do give them crackers or pretzels, try to eat some apples or some celery afterwards, just to help get the food out of the grooves of the teeth, which have the sugar on them. And a few different things you want to stay away from are goldfish crackers, regular crackers, fruit roll-ups, fruit snacks, chips, pretzels, candies, cookies, and sugary drinks you want to stay away from. Definitely soda. juice, flavored milk, iced tea, Gatorade, Kool-Aid, and if you do give them to them, have them drink a little bit of water afterwards. You really want milk to be only with a meal, and if it's a flavored milk, you want that to be a once-a-week treat. During the day, in their sippy cup or in their bottle should be water only. If they're sipping on it all day long, you want water. During a mealtime is where you could do the treats for them, because as they eat, they produce more saliva, and the saliva rinses off the teeth. Any sugar from the teeth is a little bit easier. And in the juice bottles, you want no more than 8 ounces a day. That includes if it's watered down, whether it's in a sippy cup or a bottle, you want it no more than 8 ounces a day. And I hear often, well, they're just baby teeth, they're going to fall out anyway, which is true, they are. But the first set of teeth you won't lose until you're between ages 5 and 7. And then the last set of teeth, which are the molars, you won't lose those till you're around age 12. And it's important to keep the baby teeth for a number of reasons. For chewing, to make sure they have all their teeth so they get the nutrition as they chew their food. For growth and development and proper speech development. If they're missing some teeth, they might have a speech delay to go along with it. And with not keeping your baby teeth clean, it can also affect their overall health and development. So although dental problems are largely preventable, they remain the most common chronic disease in children. Center for Disease Control and Prevention states dental caries are the most common chronic disease of children ages 6 to 11. It's important to care for your child's teeth early in life to establish good, healthy dental habits and encourage a lifetime of good, healthy dental care. Now, you need to ask yourself, are your child's teeth as healthy as they should be? Thank you.